Housing Works was created in 1990 specifically to serve people living with AIDS and HIV who other organizations either couldn't or wouldn't serve, primarily homeless people who were struggling with chemical dependence and mental illness. We've grown to be, as I said, one of the largest community-based organizations in the country, serving thousands of people, providing a full array of services from housing to healthcare to vocational training and job provision, legal services, etc. So we're a holistic integrated care program, and we've expanded beyond HIV to serve people at highest risk and people who are homeless and have other chronic conditions. We're organized with a number of affiliates, and we actually have run a sister organization in Puerto Rico that operates the largest syringe exchange program on the island, and an office in Haiti that provides technical assistance throughout the Caribbean. And then we do more global international work. We're right now working on ending the epidemic demonstration projects in 3 cities: in Port-au-Prince, Haiti, in Lusaka, Zambia, and in Kiev, in the Ukraine. It's been very, very organic. We started out trying to prove essentially what could happen for homeless people who are living with AIDS and HIV if the community cared about doing something for those people. Ended up being very successful with innovative models. We were the first organization to house homeless people while they're still actively using drugs without putting restrictions on their drug use, evicting people for using drugs. We started one of the first job training programs in the country for people with AIDS, and the very first job training program in the country for people with HIV that guaranteed full-time employment with health insurance and benefits. So as we innovated and promoted those models, we started developing more of a role, and in particular looking at how social drivers impact on the epidemic. So it really doesn't matter what part of the world you're in. If you're having to struggle with issues around sexism, racism, homophobia, transphobia, homelessness, addiction, mental illness, they all are drivers of very bad health outcomes for people, whether you're talking about HIV or hepatitis C or tuberculosis. So I think that's where our passion is, and we see what we're doing around ending the epidemic in New York, across the country, and globally as critical steps to demonstrate that if we do address these social drivers, we dramatically improve health outcomes for people, life outcomes for people, and lower the social burden that all of these social drivers end up costing our systems.